Okay, good morning. Today we're going to have the first hour will be spent on doing the teach back for the chapters 1, 2, 4, and 7 that I expect you have read in preparation for today. It's important that especially chapter 1 deals with the introduction to pathophysiology, right? So apparently it's very important, therefore, that we need to understand some of these terms that we use, particularly with regards to patients, right? In the field of nursing and medicine, we deal with actual patients. And we know that we need to be able to define words. Words such as pathophysiology, words such as signs and symptoms, etiology, right? So can anybody tell me what exactly is pathophysiology? Anyone? Yes?
The study of abnormalities in the physiological function of living beings.
So pathophysiology from two words, pathology and physiology, right? So abnormalities in terms of what? Diseases, right? From normal condition to abnormal condition, which basically talks about the study of human diseases and how to treat them, right? On the other hand, when you say physiology, what exactly is physiology? Study of what? Body function, right? What about anatomy? Study of body structure, right? Structure versus function. Can we dissociate them? No, we cannot. We always have to correlate them. An organ will be useless unless we know what the function would be. For example, the heart. What is the function of the heart? Huh? It pumps blood. Why is there a need for the heart to pump blood, my dear?
The body needs oxygen.
Yes?
The body needs oxygen.
Okay, so in other words, when the heart pumps blood, the goal is to use what? The 405 North Freeway and the 405 South Freeway, which is the aorta, right? Remember? So you have the ascending aorta, the arch of the aorta, the descending aorta, and then the thoracic, and then the abdominal aorta, and essentially what you have would be what? You're blocking the way. I'm filming this episode, okay? Days of our lives, okay? Now, so apparently, therefore, you want the heart to pump blood through these blood vessels, right? Which blood vessels are we referring to? The aorta, the biggest artery that we have, in order to reach what? All the cells in the body, right? Why? Because every single cell needs what? Oxygen, right? What about the lungs? What's the function of your lung? Exchange of what?
CO2 to O2.
Okay, so you want to exhale the carbon dioxide, you want to inhale what? Oxygen. We need the oxygen, we inhale the oxygen. We exhale the carbon dioxide because why? What is carbon dioxide to us? Waste. Anything we do not need, we excrete them. Like for example, every morning you make making poo-poo, okay, and then making wee-wee. Why? Because they contain waste. The stool contains waste. It's called feces or shit or stool. The same thing, right? Urine contains nitrogenous waste, urea, creatinine, and uric acid. They're waste. Now, in the case of humans, when we exhale the carbon dioxide, who benefits with the carbon dioxide? The plants, because what will the plants do with the carbon dioxide? In the presence of sunlight, there's photosynthesis, and when they convert CO2, it becomes what? Oxygen. Isn't it amazing? So the plants gets our carbon dioxide, converts it into oxygen, and who needs the oxygen? We need the oxygen. Symbiotic relationship. So are we going to cut our trees? No. Are we going to cut the plants that provide us with oxygen? No, you must be STUPID to do that, right? And what is STUPID? Not smart. Okay, not smart. In other words, don't cut your trees because they provide us with oxygen. Now going back to the human body. So we just talked about this thing, right? So let's say you have a 60-year-old male patient who came to the hospital, emergency room, 2 hours prior to admission, developed sudden shortness of breath, or what we call SOB, or what we call respiratory distress. Okay? And apparently, this is the reason why he came to the hospital. Now this 60-year-old male, if you review the history of present illness, 1 week prior to admission, had productive cough of yellow-green phlegm. 3 days prior to admission, developed high-grade fever with chills. And then 1 or 2 hours prior to admission, developed shortness of breath. So that was the chief complaint. What was the chief complaint? I can't breathe, I can't breathe. That means he has difficulty of breathing. In a situation like this, what do you think is this patient suffering from? What pathology does he experience? Is that now? What do you think is the problem with this patient? Yes?
Pneumonia.
And what exactly is pneumonia, my friend?
Infection in the lungs.
Okay, so what organ is involved?
The lung.
Okay, why do you consider the lung? Now, I hope you don't mind. This is how you become smart. How does one person become smart? You ask yourself what, where, why, and why. How? Okay? Why did you say the patient is suffering from it? What is the, if this were a court of law, I am the judge. So you have to explain yourself. Judge, Your Honor, the reason why I said pneumonia is because 1, 1, 2, 1, 3, 1, 4, 1, 5. Okay, yes?
Because shortness of breath.
Okay, so if you have shortness of breath, what organ is involved?
Typically the lungs.
The lung. Why would you say the lung? What is the lung for?
Like the gas exchange. CO2.
Gas exchange needed for breathing, right? But what is the muscle for breathing?
The diaphragm.
The diaphragm is the primary muscle, but because in breathing, the purpose of which to exchange gases in the lung, you get rid of the CO2, you bring in oxygen, so you're thinking that it could be the lung. That's why it's one of the most important organs for exchange of gases, so you're thinking that it could be the lung, okay? I will accept that. What else? Why the lung? Aside from based on the history of present illness, I hope you were taking down notes or you're paying attention. What would make you think of the lung as the primary organ of involvement here? Aside from the difficulty of breathing.
He's coughing up phlegm.
Okay, so when you cough up phlegm, what organ is involved again, class?
The lung.
The airways or the lung, right? The bronchi, the lung, right? Right? You understand?
Yeah.
When you're coughing, is there something wrong with your stool?
No.
Or the urine? Nothing to do with that, right? Okay? So we are in the world of science. Doctors like me and nurses like you, we have to think like a scientist. We don't have to be like Albert Einstein, but just make sure that your knowledge of anatomy has to be applied here. So productive cough of yellow-green phlegm for 1 week duration. What about the fever in this patient? What would make you think, what is this patient suffering from? Fever is an indication of what?
Infection.
Perfect, infection. What about the yellow-green phlegm? What kind of infection? Bacterial or viral?
Bacterial.
Maybe bacterial, right? So, in chapter 1, there was mention of diagnostic test, right? It has to be valid and reliable, right? So, if you were Dr. Gamo, what do you think Dr. Gamo will order in the chart? What kind of diagnostic procedures would I be expected to order in the chart? Anyone?
Respiratory
X-ray.
culture.
What?
X-ray
What X-ray of what?
for the lungs to see
So what do you call that? What will I say, lung X-ray or chest X-ray?
Chest X-ray.
Very good. So there you go. Chest X-ray will be ordered with Dr. Gamo, PAL. Do you know what PAL stands for? But it's okay. It's not your fault. You have not. Some of you are LVNs, right? You probably work in the hospital. You know what's PAL? Chest PAL? Let me answer my own question. Yes?
Pulmonary.
No, my dear.
No.
It's called posterior anterior lateral view.
Oh, sorry.
Chest PA view. Okay? Remember when you go to the. Have you ever had an X-ray done? So the X-ray plate is here, and you go like this. And then inhale. You know, stop breathing. So PA means the X-ray comes from the back, goes to anteriorly. PA means what? The plate is here, and then the lateral view. Right? Why would you recommend a chest X-ray? Well, the doctor will actually be the one to order that, but you as nurses misunderstand. Why did Dr. Gamo order a chest X-ray? Yes.
X-ray shows what kind of damages is in the lung, or
Okay.
what kind of.
Now, I know it's not a fair question, but What do you think Dr. Gamo expects to find there? Do you know? Anybody who knows? It's okay if you don't know. I will answer my own question. Huh? Well, if there's pleural effusion, yes, in severe cases of pneumonia. Cancer and infection of the lung like pneumonia can lead to pleural effusion, so there could be fluid. If the patient has heart failure, it could have pulmonary edema. But in a lung patient with infection or pneumonia, what do you expect to find? Now, well, it's not fair, but it's called pneumonic infiltrates. So when you look at chest x-ray, a normal chest x-ray versus an abnormal chest x-ray, everything is clear, nothing's wrong with the lung. In a patient with pneumonia, you can see those whitish infiltrates. And the doctor, oh, there's a hazy pulmonic infiltrates. On admission, this is what it looks like. 2 days later, upon treatment, it has subsided. It has decreased in amount of pneumonic infiltrate. What does that tell us? The patient is improving. Not only that, after a few hours after admission, the patient's fever will go down and the patient's cough will be decreased in intensity and severity and frequency. So we're doing a good job, right? Hopefully. And the white blood cell count will start to drop. Okay? You understand what I'm trying to say? So are we going to do a CBC or complete blood count here? Yes, because what is it that we're expecting to be elevated? The white blood cell count. Normally the white blood cell count value ranges from what? 5,000 to 10,000. Are we good with it? Can you see my face? Very good. 5,000 to what?
10,000.
10,000. Anything above 10,000,
It's infection.
it's leukocytosis. Leukocyte is another word for white blood cell. It's an indication of a possible infection. Now, what will tell me that this infection we're dealing with is a bacterial infection? What did you learn from anatomy and physiology?
Culture.
No, about the white blood cell count. Now remember, there are different types of white blood cells.
Yeah.
They're fighting with infection.
You are right, but what exactly? Remember, the white blood cell has what? Granulocytes and what? Agranulocytes. Under granulocytes, you have what? Neutrophil,
Yeah.
eosinophil, and basophil. Under agranulocytes, you have what? Lymphocytes and monocytes. Okay. So once I mentioned, which do you think, if elevated, will tell you that we are dealing here with a bacterial infection? Basophil is wrong. It's okay. Try answer. Come on, give me your answer. Could be right. It could be wrong. Don't be afraid. Yes. Well, bacterial infection. It could be something else. Yes. Huh? What? 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 Repetition is the mother of what?
Knowledge.
Retention. Retention of what? Of what?
Knowledge.
Of what? Knowledge, right? We want to be smart people, right? Smart people retain information that is relevant to their practice of nursing. Now, you don't want to be a doctor, but you want to be a nurse. So when Dr. Gamo orders a CBC with WBC differential count, what is the purpose of the WBC differential count? I, as a doctor, would like to know what is the value of neutrophil, eosinophil, basophil, lymphocyte, monocyte. Why? Because if the neutrophil value is elevated, can I consider a possible bacterial infection here? Anything above 70% will be elevated for neutrophil values. Where did we learn that? Anatomy and physiology and anatomy and physiology, right? So if your background in anatomy and physiology is good or very good, you will definitely get an A in this class. You understand what I mean? That's why in the chart I will put the CBC with WBC differential count. Do you understand what I'm trying to say? Okay, so the lab people will know that. And make sure when you put the specimens about the phlebotomy, you should know that it's properly labeled. I want a WBC differential count. Now, but most importantly, what is the term that means cause of the disease? Etiology. E-T-I-O-L-O-G-Y. The cause of the disease. Would you be interested what kind of infection we're dealing with? Is it viral or bacterial? If the neutrophil value was elevated, it could be possibly what? Bacterial. But we want to confirm what diagnostic test would be appropriate for this case. Yes, my dear. You seem to be very quiet and very pensive. As if What do you think will Dr. Gamo order? Your notes are so extensive, I can tell. Let me see this note. Wow, beautiful. Okay. Look at her notes with all the post-its. Wow, wow. And then, okay. So now let's find out if this information is here inside and can now be applied to what we're about to discuss. What diagnostic test do you think would be appropriate for a patient where we're considering pneumonia, the neutrophil value is elevated, which is possibly bacterial, but we want to know, is it really bacterial infection? So what diagnostic test would Dr. Gamo recommend or order in the chart? Culture. Okay. What about culture? What kind of culture? There are many cultures from different civilizations. I'm just kidding. With the word culture and civilization, but you're referring to a different culture here, I think, right? So can you be more specific than culture? No, I'm just making us laugh, you know, but it's not going to humiliate you. I know you are in the right path, but tell me exactly, what is it? What kind of culture? What specimen would I be asking you to collect? Yes, my dear? Remember this? 1 week productive cough of yellow-green phlegm, fever, and everything? Yes? Okay, yes, what's your answer?
Would it be like a throat swab?
A throat swab, okay. Let's dissect your answer. You know what dissect means? Scrutinize your answer, right? You're going to perform a throat swab. When doing a throat swab, you swab the throat. Okay. If you were to retrace our steps a few minutes ago, where is the problem here in this patient? What organ is involved? The throat or the lung?
The lung.
So if you do a throat swab, are you going to get specimen from the lung?
No.
No.
There you go! So your answer is right or wrong? Perfect. I'm not trying to humiliate you. Some people are very sensitive. At the end of the 9th week, they make these comments, faculty. Dr. Gamo is so arrogant. It's because he's a doctor. He thinks he's above everybody else. I don't even know what that word means. He speaks above us or below us. I don't know. Talks down to us. How can I not do it? Because I'm taller than you. I talk down on you. I'm just kidding. I'm not kidding. If people don't like you, they don't like you. What can I do? You don't like my handsome face and my beautiful brown exotic skin? I don't know if they discriminate my beautiful skin. Yes, my dear? So what else? Want to change your answer?
Spit.
Spit! Okay. When I spit, what specimen will I be collecting?
Saliva.
Okay, saliva. Where does the saliva come from? From the lung or the salivary glands? See? So that's what you call the quest for knowledge and wisdom comes with learning mistakes, right? That's right. So when I spit, what is collected there? Yes? What is it?
Saliva.
Exactly. And where did the saliva come from?
Your mouth.
The salivary glands in the mouth. The parotid gland, sublingual gland, submandibular gland. Mandible, sub means below the mandible. Sublingual below the tongue. Parotid in front of the ear. So, are these areas infected in this patient?
No.
So is that the right answer, therefore?
No.
Can't be, right? Can't be. So we don't spit. Okay. Okay, that lady was about to yawn and sleepy. Okay, you. How do we get a sputum specimen from our patient? Let's say, what's your name?
Jamie.
Nurse Jamie. Nurse Jamie. You're wanted in the nurse station. Dr. Gamo is there, so I'll talk to you. Nurse Jamie, I want you to collect a sputum specimen because I've ordered here in the chart a sputum CS. CS stands for culture and sensitivity testing. So, what kind of container will you use for this patient, Jamie? A sterile container or a clean container? And why?
Sterile container.
Why?
So it's not
Answer is correct. What?
so it's not contaminated.
Very good. There should be no contaminants, right? Okay, now you are in front of the patient. You're the nurse. I'm the patient. You come to me. Dr. Gamo, how are you today? I heard that you were admitted for 1 week duration of productive cough, 2 days of fever, and then you are now having respiratory. Hope you die. Okay, of course not. Okay, what do you say to me? Okay, you have a special container with you, sterile container. My name is there. Joel Gamo, room 555, and then sputum CS. So what will you tell me? Pretend that this is a movie. Days of our lives, okay. Yes. For what?
that we need to-
So you introduce yourself. Hi, Dr. Gamo, my name is Nurse Jamie. I used to be your student at West Coast. Now you are my patient. I will kill you. Of course not. Joke only. And you say, okay, what will you tell me? You introduce yourself and you are here to get what? Specimen, okay. So what will you tell me to do?
Cough.
I think I'm going to hire you already, okay? Because you gave me the right answers. You tell the patient to cough. Are you going to demonstrate to the patient how to properly, effectively cough?
Yes.
Yes or no?
Yes.
Okay, come show us. Be an actress. Lights, camera, action! Okay.
Well, I would explain to them that we need them to cough.
But you have to, even said you have to demonstrate. You said yes to me, right? Okay, go ahead. How do you do an effective cough?
I don't know.
Okay, who wants to demonstrate? You'll be on live camera. Miss Dele, you wanna turn red again? See, she's turning red again. Okay. I like her. In a positive way, you know. Oh, yes, there, my friend. What's your name?
George.
Hi, George. Do you know how to do an effective cough? Nobody knows how to cough? Yes.
Deep, and you breathe deep.
Deep and you breathe deep. So, okay, let me just be an actor for a minute. You know, I'm a frustrated actor. Not only actor, but singer. You know, I like karaoke singing. And I like to do acting. So, is this a good cough? No. What about this one? Overacting cough, but that's the cough I want, right? Especially that I have a cough right now. I have my holes here and all this sore throat. I'm really coughing, so I could be an actor. Can actually get the sputum specimen, right? But most importantly, you do not want saliva. What happens if the nurse fails to explain and demonstrate to the patient? All you do is, sir, I have this sterile container. I want to get your sputum specimen. Some people don't even know what the word sputum means. I'm not kidding. I'm not saying that they're not high school graduates or... Some do not know the difference between saliva and what. So guess what? Okay, I'll be back in 5 minutes, sir. You go to the nurse's station, you play with your... Look at your Facebook account. Oh, 5 minutes is done. Can I get the specimen container? Guess what probably the patient did was what?
Yeah.
What? Spit. Spit, right? So now you are. So what specimen will be in the container? Saliva. You bring it to the lab. Now I'm very proud of my wife. She's a microbiologist at Cedars-Sinai. She works. That's how we met. We met in the hospital in the Philippines. I was a medical student and she was working in the hospital. So she works now at Cedars-Sinai. We give them the specimen and they process the specimen, and 1 day later, wow, heavy growth of Streptococcus pneumoniae bacteria, because you can see that under the microscope. There's a one. So the culture medium is designed to make the organism grow. Let them grow, let them grow, let them grow, so that we can identify them and kill them. What do we want to kill? The bacteria. They're the enemy, right? So in a Petri dish, you have the Martin, whatever, chocolate agar medium. You have a disc. You know what's a disc? Antibiotic disc. What does that mean? So is this where? Am I still good with the camera?
Yes.
Very good. Okay, this is the Petri dish. You put what? Culture media. What else do you put? Blood, because they love blood. I think, I don't know why, they're probably like vampires, you know. Blood agar, Thayer Martin, blah blah blah. Everything that is rich in nutrients for the bacteria to grow. And then at the same time we put what? A disc. A disc for what? Penicillin. A disc for ceftazidime. A disc for what? Gentamicin. A disc for garamycin, whatever other drug you want to see. Okay? How do you know that? So after 1 day, you have a growth of what? I don't have any other organism, but let's say this is the organism. Okay. How do you know that the antibiotic is effective? You have a zone of what? Clearing, it says, right?
Yeah.
So among the 4 drugs, what would be the most effective drug? Ceftazidime, the 3rd generation cephalosporin. Because it killed the organism. Would I give penicillin? That means the Streptococcus pneumonia bacteria is resistant to this, to this, to this. If I give this to the bacteria, it will just only what? Tickle, tickle, tickle. And if only the bacteria could speak, the bacteria would say, "You're so stupid. You did not rely on the resource of CS. How could you be able to graduate from medical school, right? Or nursing school? You should have given ceftazid, I would have been dead. I'll be resting in heaven for bacterial heaven." I'm just kidding. Is there a heaven for bacteria? Of course not, okay? The bottom line, therefore, is that we work together, just getting the specimen, it has to be the right specimen. An incompetent nurse does not demonstrate. An incompetent nurse does not explain to the patient. And that's exactly the reason why there is mismanagement, mistreatment, because in the chain of command, we have to work with smart people like you, because while you come from the best in the West, you come from West Coast. You have to believe that. You have to think that you're smart to become smart. If you think that you are DUMB, then you will always be DUMB. But because you come from the best, isn't it rhyme? West and best, West Coast. If you come from what's your school? Okay. Are you proud of it? You are from West Coast?
Sure.
Of course. If you did the right thing, and I'm the patient, and you saved my life, the first thing I would ask you is that, what school did you come from? You just saved my life. What school? West Coast. See? And I will tell the people from administration, get people from West Coast, the best in the West. They will never get a saliva specimen for a sputum specimen. Right? Why? Because they know the difference between saliva and what? Sputum. Saliva comes from the salivary gland. The sputum comes from where? The lungs and the airways. Does that make sense? Okay, now going back to this. So, the cause etiology we are able to establish. Strep pneumonia, pneumonia. The patient goes home. Happy that he was saved, right? Okay, now, a patient goes to the emergency room and goes, what is that? Chest pain. What is chest pain? Is that a symptom or a sign?
Symptoms.
Why do you say symptom in here? What's your name?
Yeah.
We were in the, yesterday, right?
Yeah.
The people were in the virtual classroom. Okay, Cynthia, let me say, because I already asked this question. In the virtual classroom, I had a session, like a mini session, similar to what I'm doing here now, right? So you probably know the answer already. Why do you say chest pain is a symptom?
Because there's no way for me to validate the level of pain they're feeling.
So what word am I looking for? Subjective or objective?
It's subjective.
Exactly. We talked about this yesterday, remember? Subjective, because you cannot. So when I go like this, I have chest pain. Can you see my chest pain?
No.
Can you feel my chest pain?
No.
Or who feels the pain?
Only patient.
Only the patient. You cannot verify, or the word you said validate, right?
Yeah, it could be reflex.
Or it could be what? Okay, look at me. Look at the big difference, okay? I go to the hospital, I go like this. Am I clutching my chest? Yes. Now, look at the big difference. I go to the hospital and I go like this. What am I doing?
Smiling.
Huh?
Smiling.
I'm smiling, okay? I'm clutching my chest at the same time smiling. Does it correlate?
No.
I must be crazy. I'm just kidding.
Have you seen people with reflex? My grandpa does it. It looks like he's having a heart attack. He's like, oh, it's heartburn. And then he stops. And I'm like, oh my God, I thought you were
Okay.
having a heart attack.
So this is not a reflex. It's more of, in medicine we call that malingering. It's a psychological, not a diagnosis whereby people pretend to be sick when they're not sick. What is the purpose of that? Now I'm not talking about your grandfather, because your father has a heartburn, you said, so it's different.
They
The
need
point is,
attention,
they want attention, what else? Secondary gain.
Same.
So, like in the family, some of these people, I have chest pain, oh mom, what's wrong? Okay, I'll give you to the hospital, and then actually they're not sick, but they just want, mommy, daddy, you want to go shopping, mommy? Okay. But, okay, this is one thing, by the way, I don't want to overemphasize that, because anybody with chest pain, regardless of the age, what is the best way to get hospitalized and be admitted?
Chest pain.
Chest pain. Whether you're smiling or not, it doesn't care.
Yeah.
The moment you tell somebody in the emergency they have chest pain, you have no choice to work you out, you know, with all the ECG and all these things. Now, heartburn is different because heartburn, do you know what's a heartburn right there? Cynthia?
Reflux?
Reflux, okay. Were you talking about reflux and then a reflex?
No.
I thought you were talking about reflex versus reflux.
No, I said reflux.
Okay, I heard reflex. I said, okay. So reflux, okay. Acid reflux disease is different, right? In reflux diseases, what happens is that the acid in the stomach goes where? Into the esophagus. Why? There's something wrong with the cardiac sphincter, okay? So when your grandfather had a heartburn, it could be chest pain, but just be very careful. This happened a long time ago, like 5 years ago. I was watching television. A 50-year-old retired football player, NFL player, had chest pain. So they called 911, the paramedics came, and they're not doctors. I'm not saying they're not doctors, so one of them said, "Oh, don't worry, sir, it's just a heartburn. Just take your medications for hyperacidity, you'll be fine." 1 hour later, what happened to the patient? Died of heart attack. So apparently that chest pain was not because of heartburn. It's the reason why whenever somebody has chest pain, what do? Bring them to the hospital because we need to do the diagnostic test, the electrocardiogram, you know, cardiac enzyme levels, blah, blah, blah. You understand what I'm saying? So I'm not saying that, you know, but if your grandfather has been having that heartburn for some time, but just the same, you know, you can never tell, okay? Now, how do you know it's cardiac origin? Because the chest pain is substernal, heavy in, as if there's an elephant standing on your chest, and then what? It radiates to the arm, the shoulder, a hand, and the forearm, and, you know, radiate, and the jaw. Okay? Do you understand? Now, what about if a patient comes to you and say, "Hey, Dr. Gamo, I have right knee redness." What is that? Pain versus redness. Right knee is red. What is that? A sign or a symptom?
Sign.
Why would you say it's a sign?
Because I see that.
You can see and validate. Oh, say, yeah, you're right. I can see. Now, if you see it's red, what do you think is happening to the right knee? It's inflamed, right? Remember the cardinal signs of inflammation. Rubor, R-U-B-O-R, redness. Calor, warm, so you can palpate. If it's really warm and red, it could be inflamed. Arthritis, right? What else? Tumor. Tumor means T-U-M-O-R, increase in size. And what is dolor?
Pain.
There should be pain. You understand? Okay? Now, in the clinical manifestations, we also have, what is the meaning of the word latent period? It's basically the onset of what? Exposure to
Infection.
the organism. Let's say, today I'm coughing, I'm sneezing. You're fine, you're normal. But tomorrow, when you go home, you develop a cough. It took how many hours? 24 hours. So the latent period is defined as the time duration upon which you were exposed to the organism and the first manifestations of the signs and symptoms, like cough, right? So it took 24 hours. On the other hand, what is prodromal period? Prodromal means what? When you see the first signs and symptoms, which will occur tomorrow. I'm predicting it because I'm a very generous person. If I'm coughing, I always share my virus to everyone. That's how big my heart is. I'm just joking, of course. I should cover my mouth, right? So, understand? So, now, what is the difference between acute and chronic? Chronic means what?
It's forever.
It's months,
Yeah.
years, right? Like acute kidney failure versus chronic kidney failure. If you have kidney stones, it can lead to acute kidney failure. Once you remove the stone, you're back to normal. Now, what happens if that stone keeps on coming back every month, every 6 months? And another year, another stone, another year, another stone. Can that become chronic kidney failure? Yes, because the damage could now become permanent. In chronic kidney failure or chronic kidney disease, you could be a candidate for a kidney transplant or weekly dialysis. You understand what I'm saying? So there's a difference between acute and chronic. Now, what's another word for recovery stage? Convalescence. Very good. Convalescence. Like you have a convalescent hospital trying to recover, right? Okay, now, in terms of levels of prevention, you have different kinds of levels. Which one is it that will make you alter the susceptibility through immunization and vaccination? Primary. So how do we protect our kids? Mom's measles rubella vaccine. How many of you are not in favor of vaccination? And should not even be in nursing school, right? Or medical school. What was the purpose of vaccination? There are two types, passive and active immunization. In active immunization, what do we give the patient or the child?
The virus.
Virus.
The live attenuated virus, so that they actively develop their antibodies. What's another word for antibodies? I hope you know, I'll answer my own question. I'm going to try not to. It's called immunoglobulins, right? These are proteins produced by the B lymphocytes or the B cells, correct? Okay. So, giving them the virus, which is live, and what is attenuated? It's not going to be harmful, but they may develop some fever, but they will develop their antibodies so that in the future, once they get exposed to the same virus, they have protection against that virus. Why? Because they already have developed what? Antibodies, and you can even measure the titers in the blood. What is passive immunization? Passive means you are injecting them with what? The antibodies themselves. You understand? It's passive immunization. Okay? So that's primary. Now what about secondary? Prevention. The early screening, diagnostic screening. For example, to screen for cervical cancer, what do we do for women? We do pap smears, right? I never had one done because I'm not a woman. It's called cervical pap smear, but I have done one many times as a medical student and intern, right? For women, for possible breast cancer, what do we recommend that they do?
Breast exam.
Manual self-breast examination, which includes the axilla and the armpit, because you can involve the axillary lymph node, right? In a very organized way, okay? Be the one doing yourself. Okay, now what else? A mammogram, right? Okay. What about for men? What do you recommend for men? Yes, my dear, what do you recommend? The prostate exam, very good. Why? Why would you recommend a 50-year-old man like me? I'm 57 now. When I turn 50, what prostate exam would be done? What is the specific term we use? Yeah. Have you ever heard about the prostate exam that the doctors do on men?
Yeah, rectal exam.
Very good. So what do we insert into the rectum?
The doctor's hand.
The entire hand? What?
Fingers.
Okay, called digital, digits, fingers. Which one, the dirty finger or the index finger? Or both index and dirty finger?
Both.
Okay, both, of course. Are we going to wear gloves? Are we going to put KY? Why?
Lubricant.
On both patients.
Is it easy or to lubricate? Be more nurse-oriented, you know. I want to, a KY, it's going to be easy. But you want to lubricate, that's exactly what I want to hear, right? You know what lubricate means? What is the purpose of lubrication? Why do we put KY? What does KY do?
Reduce friction.
Huh?
Reduce friction.
Perfect, reduce friction. Can you imagine inserting 2 fingers into my anus? With glove without lubrication like KY? I would be in severe pain. Like a virgin. Oh my God! I cannot forget, this is just sharing time, you know. And this really happened. As you know, I teach at UCLA, right? So one day I went to my primary physician, a lady physician who's single, and we're of the same age, but she's single, I'm double, you know, I'm married, so. So I was telling her that, you know, she knew that I was teaching at UCLA, I was a professor there in the medical school, teaching medical students, and she actually graduated from the same school where I teach, in the 1980s, we're of the same age. So, and she goes, oh, Dr. Gawa, she just keeps on talking and talking. I was really wearing my lab gown and without any underwear, you know. I didn't wear my panties. Joke only. So, my big panties. So, she was telling me that she's going to do a prostate, but she did not tell me that she's going to do it at that very moment. She just goes, okay, bed, back. I was not prepared. I wanted to cry. It was so painful. I'm not kidding. I think she expected that I knew what was going to be done, but she was talking to me and then, of course, turned around and so I said, now I'm going, you know, it's step-by-step procedure, you know. Dr. Gamal, I want you to turn around, I'm about to insert my 2 fingers, you know, and then gently insert. But no, you know, shit, I said, It was so painful. It was very tight. Now, why would you be able to palpate the prostate when you do a rectal exam? That's the best question I could ask you. What is the relationship between the rectum and the prostate? Where is the prostate found? Where is the rectum found? Yes, my dear, you know? Do you know what we're talking to? Yes? Anybody? Okay, I'll answer my own question again. Anus, rectum. When you insert the rectum, the prostate gland is right in front of the rectum, here, right? So when I insert that, the prostate gland surrounds the urethra, right? Penis, the inside. So what happens is that if this is the prostate and this is, can I borrow your notes? Don't worry, it will not be smelly afterwards. Let's pretend this is the anus and this is the rectum. So there is what? Shit in here, a stool in here, right? So when I insert, the prostate is here. Can you hold this, my dear? Okay. Camera. This is the prostate gland here, right? This is the anus, the rectum. So I put my finger there. Can I be able to palpate the prostate gland? The prostate is this one here, right? Yes, I can. I can determine whether it's enlarged, whether it's firm, it's hard. When I touch and it's painful, it's called tender. Okay? You understand? Okay? And then if it's enlarged, can we do a biopsy? Ultrasound guided prostatic biopsy. Because what is the biopsy for? Determine whether it's benign or what? Malignant. You know what I mean? Biopsy is always the best tool to determine whether a mass is benign or malignant. Do you understand? Now, what is tertiary? Yes?
How are we doing biopsy?
Ultrasound guided.
Via rectum?
Yes,
we are
baby.
just putting this.
Can I-
Okay.
Okay. Or sometimes they can do transurethral when they do the, you know.
Okay.
Because of course you know, well, there's always a stool there, but in terms of the transurethral, you're passing through the urethra and then, you know, the prostate is around it. Like when you do transurethral resection, prostatectomy. Now, you insert the device inside the urethra. Okay? Now, what is tertiary prevention then?
Rehabilitation.
What? Rehabilitation. That's my specialty. After medical school, I went into a residency training for 3 years called Physical Medicine and Rehabilitation. I became a dean of a physical therapy school. Okay. Okay, who is the quietest person in this class? The person who has not been opening their mouth. Let's ask. I will volunteer that person. Okay. Anybody who wants to volunteer among the quietest person? Let's see. Okay, that lady there. She's very quiet. What's your name?
Vanessa?
Come on, Vanessa. I volunteer you. Come on, come on. What is your name? Vanessa, right? Okay. So today we are honored by the presence of Nurse Vanessa. Okay. You are from West Coast, I suppose, right? You graduated and you're now going to work for the West Coast Medical Center. Okay, let's pretend that this is an interview whereby you will hire you or will not hire you, okay? So Nurse Vanessa, let's relax, just chill, you know. Whatever answer you give me is correct or wrong, it doesn't matter. Because we're here to learn, right? It's going to be a learn. Can you move a little bit here because...
I don't want to go for
Oh, you don't want to be on camera, okay. No problem. But we have no choice because we have to demonstrate. Okay, now, question is this. Vanessa, a patient was brought to the hospital because of left hemiplegia. He suffered a stroke. Paralyzed on the left arm and the left lower extremity. Okay? You were told by Dr. Gamo to do gait training on this patient. Gait training means training them how to walk again. Now, among the devices that you see there, Vanessa, which one would you choose? Okay? You have a walker, a pair of crutches, a quad cane, and a single tip cane. Which one do you think is best for Dr. Gamo's patient who has left hemiplegia? He's paralyzed on the left side of his body.
I'll use the walker.
Walker. Give me the walker, please. So I am the patient. Let's pretend I am the patient. Okay, this is the walker. Okay, the walker is here, and you need to give me that belt. Okay, you have to apply the belt on my back. Okay, what is the purpose of gait belt? To support the patient, and you can hold the patient, right? Okay, I'm going to wear the gait belt in like this. Okay, and then of course make sure that it is properly attached, right? Okay. Okay, which one would you stay? On my left side? I am paralyzed on the left side. Where will you stay, Vanessa? Left side or right side?
Left side.
Why? Okay, stay on the left side.
Support.
Huh?
Support the left side.
Okay, go ahead, stay on the left side. You are now on the left side. You have to hold the gate belt like this. Okay? Gate belt should be held like this, not this way. Why? If you do it this way, it will fall. It will slip, right? So up like this. So that will be a firm grip like this, okay? Is the answer correct? She will stay on my weak side or left side. Is that correct?
Yes.
You are really from West Coast, right? Okay. Okay. This is the walker. This is the first answer. I'm paralyzed on the left side. Have you ever tried using a walker?
No.
Okay, go ahead, demonstrate to me. If you were to use a walker, what would you do? Go ahead, there you go, perfect. Very simple, right? Okay. Now, I'd like you to do critical thinking here. What is critical thinking? Common sense thinking, okay. A patient is paralyzed on the left side. Do you think, hold this here, do you think I can use a walker with one hand paralyzed,
No.
left leg is paralyzed? Can I use a walker?
No.
Why not?
Because you won't be able to hold it from the other hand.
Of course. So this is not the right device, right? What happens? Can I be doing this? St. School of Nursing, St. Jude, or whatever school of nursing. But West Coast, Dr. Gamo, I will never use a walker. Because in order to use the walker, I need to use both hands. But one hand is paralyzed, how can you use the walker? That's most important to realize that you cannot, right? Out with the walker. What about the pair of crutches? Can we use the pair of crutches here, my dear?
No.
Hmm? What do you think?
It would be hard for you, no?
Have you ever tried wearing
No.
crutches? Okay, go ahead, go.
No, I think
Okay. So do you think I can use this? Why not? See? Why not?
you're gonna fall.
Not even that. Can I even hold this? Huh? Why, it's paralyzed, so. What is common sense thinking? Critical thinking, right? A smart nurse will not use a walker, will not use what? A pair of crutches, right? Were you hit?
No.
Good. I thought you would be hit, so. Now you have two. Which one would you use? Single tip or quad cane?
This one.
Why? Why quad cane?
More support.
Why? Why would there be more support here?
Can't hold it.
Why?
It's a sport.
Or what? Because they're what?
There's more support in the bottom.
Why? Why would there be more support? Yeah, if this were I know what you mean, but you have to explain to me. If I were your grade 1 student, why teacher? Why would there be more for support here? How many support do I have here?
4.
Exactly, teacher, right? 1, 2, 3, 4, I know how to count. You know what I mean? That's the reason why it's called a quad cane. What is single? 1. What is this? 1, 4. Okay. Vanessa, right? Which hand will I be using to hold this? Right or left?
The right one.
Why?
Because you can't use your left hand.
Why it is what?
Paralyzed.
Exactly. Don't you love this class? This common sense, Jesus Christ. How can you not be getting an A in this class? All you need to do is use your common sense. I can't use my left hand, it's paralyzed. No! I'm not supposed to say that, people get offended. Right, very good. Okay, you're going to stay on the left hand, very good. You're going to use me a cane, very good, on the right hand, okay. Very important, Vanessa. I want you to think carefully, Vanessa. If I move the cane forward, which foot should follow? The left or the right foot?
The left.
Left foot. Why would it be the left foot? Not the right foot? Are you sure it's not the right foot?
I say the left, so that way it's like, I don't know, yeah.
Okay, so cane, then followed by what?
Left.
Left foot, then what?
And then use the right one.
Okay, then what next?
Then the cane again.
Cane, and then what?
And then the left.
Oh, so you're already hard. In the other class, guess what happened? The nurse from another school graduate came, and what was her answer?
Right.
All right.
Her actual initial answer was left, but she changed her because I asked the second question. Are you sure? Oh, okay. Okay, right foot then. So what happens if you use the cane? Who needs the cane, the left or the right?
The left.
Why? Because who needs the support? The left, right? So, okay, go ahead. Cane, left foot. Cane, left foot. Right? Am I happy? I'm even dancing, right? So what happens if you came up with the wrong answer? This is what's going to happen. Let's pretend she came up with the answer of a right foot, right? Cane, right foot. But does right foot really need support?
No.
Strong dog? No. So what happens now, the moment I move my one?
Left.
Boom. Are you okay?
I'm dead. Why am I dead? I had a skull fracture, I developed epidural hematoma with increased intracranial pressure, brain herniation, I died. I'm now in heaven. I'm looking at you, I'm going to kill you on November 1, all same day. You understand what I'm saying? Now, I know she was not. Now, if these things happen, what are you supposed to do? Of course, I just overreacted.
Yeah.
I could have prevented from falling by what?
Holding on.
Oh, go ahead. So even though she made the wrong decision, let's say she was the wrong nurse, but because she's holding me here, even though, bang, pull me so that I will not what? Do you want to lose your license? You better, I'm not kidding. You want to keep your license? Okay, let's give her a big hand. You have the right answer, right? So between the nurse who made me fall and the nurse who did the right thing, of course, who gets hired? The nurse who did the right thing, right? Okay. Now, in terms of chapter 2, it's dealing with homeostasis, equilibrium or balance. We're talking about the need to bring back to equilibrium or balance, right? It's a very common thing in the body, right? Like example, when you jog, your heart rate goes up, your blood pressure goes up. What will the body do? Through the parasympathetic, it will bring it back to normal by slowing down the heart rate, right? In the general adaptation syndrome, what is the first stage? By Selye.
Alarm.
Huh? Alarm. Followed by what? Huh? Resistance or adaptation. And what's the third stage? Okay. Exhaustion, right? We also talked about this in the virtual classroom yesterday. Here, alarm means what? Fright and flight. When there's building on fire, what do we do? Are we going to stay here forever and die with the fire? What do we do? See that green light there? It says what? How many exits does this room have?
One.
Is this a safe room?
No.
No. Can I sue this school?
Yes.
Class action suit. This is not ideal for 30 students. In the event of the fire, we'll all be what? Going there and what if the fire is coming there? If the fire is starting there, we're all going to be fried chickens here. And if I survive, I will get all your money. I'm going to file a case against them because I pity those 30 people who died, but I'm the only one who survived. I get all their money. I'm just kidding. You understand what I'm saying? Okay. So, we want to have, there should have been two, I don't know why they only have one. They could have opened another door there, right? You understand what I'm saying?
Yeah.
Let's write them a letter tomorrow. There was a session in class, we found out that you only have one fire exit. In the event, if the fire starts there, then we'll all be dead. So before we die, make sure we make the second door before the end of this term. And this, I hope they can think about that, right? Now, so here, remember, what is involved would be what? The sympathetic system, right? Okay? And remember the hypothalamus, you know that, right? The hypothalamus is part of the diencephalon, right? Epithalamus, thalamus, hypothalamus. Okay? What does the hypothalamus secrete?
CRH.
What is CRH? Corticotropin releasing hormone, right? Releasing hormone because it acts where? Okay, remember? It can act on the what? It can act in two pathways, right? One would be what? The anterior pituitary gland will secrete ACTH and it will go into the blood circulation, traverse to the 405 South Freeway, And then goes where? Adrenal cortex, which releases what? Cortisol, which is what? Glucocorticoid, which is adrenal cortex, and the other one is what? Aldosterone, which happens to be the what? Mineral corticoid, right? Okay. What does cortisol do to the blood glucose? Why do you want high blood glucose? Because you need energy to survive, right? On the other hand, it can also act where? What? Adrenal medulla through the sympathetic system, right? Adrenal medulla. CRA can act on these. And what is released here will be what? The catecholamines, right? What are these? Epi and then what? Epinephrine, correct? What will these do to the heart rate? Increase heart rate. Now, what is the sympathetic response? It's the neurotransmitter involved, epinephrine, okay? In the fight or flight situation, you want to survive. How many of you here wants to die? Nobody, right? Everybody wants to live. Like me, I want to live because I have 3 kids. My wife, it's fine because she has a husband possibly when I die. My 3 kids, they will no longer have a father. They may be a stepfather, but they can never replace me. So I don't want to die. And I don't want to die because of you. I want to die because of my children, right? So what happens now? My pupils should be able to what? Right? So they can see that fire exit there, right? What happens to the heart rate? It goes up because you want to pump blood where? To the muscles of the leg and the foot so that you can run away. You also want more blood to go where? To the brain, the heart, and the lungs, and the vital organs. You do not want blood to the skin because the skin is irrelevant during this time, right? You want more blood to the brain so you can think, am I going to use the elevator or the stairs? Why stairs? Because the elevator can get stuck and you'll be a fried chicken inside of the elevator if there's a burning building, okay? So what about your lungs, their bronchodilation? What about your peristalsis? Slower or faster? Slower. You want to be constipated because is there time to go make poo-poo? Can you imagine the building is on fire and here you are, you raise your, Dr. Gamo, can I make poo-poo first? I want to die. So you're sitting there on that toilet bowl. Where's the fire? Come on, fire, kill me, kill me. Because you don't want that to happen, right? So your body will attempt to slow down what? Peristalsis. Will be slowed, you know, constipate. What about your bladder muscles? Relax or contract? Contract, so that when you're going down the stairs, you're going to be making wee-wee. Is contraction the correct answer? Huh? What's the correct answer? You want the muscles to relax, my goodness. Can you imagine if your muscles there are contracting, the urine will flow. And everybody's making wee-wee. And one stupid student said to me, Dr. Gama, can we make that wee-wee to stop the fire? Do you think we can all do that? Even men can only do that. I don't know how women do it, but I know what. And the fire is there happening. Joke only, okay. It was funny, can you imagine? Stopping the fire with urine. So obviously the bladder muscles has to relax. But the sphincters must be tight. Why do you want the bladder muscles to relax, the detrusor muscle? So that you can accommodate the urine because there is no time to make wee-wee. There's no time to go to the restroom and just make wee-wee. Because by then it will be too late, right? Okay? Do you understand? Now, so the goal really is to survive. Nobody wants to die. Now in chapter 4, we deals with cell injury, right? There are reversible versus irreversible. The most common example given in the book on reversible cell injury was hydropic swelling. Hydropic means what? Water. The cell is swollen. Why? What's wrong with a patient whose cells are in hydropic swelling? Yes? What is the problem here? This is the cell. This is the nucleus, cytoplasm with all the organelles, mitochondria and everything. Have you heard about the sodium-potassium pump?
Yes.
Okay, how many atoms of sodium are being pumped? 3. Sodium, what about potassium? Now remember, what is a sodium-potassium pump? It's an active transport pump. What does that mean? It requires what? Which is energy produced by the mitochondria. It moves from what? From low sodium to what? High. So there will always be more sodium outside than inside. That's why it's from low to high. Like climbing a mountain, that's why you need what? What about diffusion? From high to low, no need for energy. But this is what? Going up, you need energy. For sodium. What about potassium? Low to high. You have more potassium inside than outside, from low to high. 3 sodium going out, 2 sodium going in. Now, have you heard of the word ischemia? Decreased blood flow. Like example, in the heart, this is the aorta here, this is the coronary artery. What kind of blood does it give to the myocardium? Oxygenated blood, arterial blood. The moment you have fat deposits there, right? What will it do to the lumen? Narrow. What happens to the blood flow? Less. Less blood, less oxygen. This area will develop what? Myocardial what? Ischemia, not yet infarct. Ischemia means what? Decreased blood flow. Will there be angina or chest pain? Yes. Okay? But what will be the effect here? Lack of blood, lack of what? Oxygen. Will that affect the mitochondria's ability to produce ATP?
Yes.
So in the presence of ischemia, lack of oxygen, less ATP, will that affect the sodium-potassium pump? The moment the sodium-potassium pump is affected, can you be able to pump sodium out?
No.
The sodium remains where? So remember, wherever sodium goes, water will what?
Follow.
Water will what?
Follow.
So if the water goes inside the cell, can the cell become swollen?
Yes.
Is that why it's called hydropic swelling?
Yes.
So what am I trying to drive at here? Everything can be explained by anatomy and physiology. If you know what is normal, then you know what is abnormal and the effect on the ability of the sodium-potassium pump to pump sodium out. If the pump is not working because of the lack of oxygen, guess what? Sodium remains inside the cell, and as I said, wherever sodium goes, water will follow, and therefore the result will be water will go inside the cell becomes swollen. The good news is that, is this reversible or irreversible?
Reversible.
Okay, Dr. Gamo now orders what? Patient with chest pain, angina, I will order nitro what? Glycerin. Under the tongue, or in medical skin patch here. This is a vaso what? Dilator of the arteries, right? So can it vasodilate here? So when you vasodilate here, what happens to the blood flow? Increased blood flow, more oxygen. Can we reverse, therefore, the problem? Can we reverse the problem? That's why it's called reversible. On the other hand, after 10 years, the patient with chest pain still keep on eating fatty food, not exercise. I'm a very good candidate for that. Look at me. I have so much fat here. And where do you think my excess fat will go? In my heart. Like this, like this. So as time goes by, in 2002 I had no fat. 2018, look at that, OMG. I used to have a 6-pack of muscle, now it's just 1 pack of fat. Why are you laughing? You like my fat? You're envious, huh? The fat will go there, because there's no other place to go but there. And then as the fat gets bigger and bigger, the blood flow becomes slower, and when the blood flow becomes slower, you form a blood what? A blood clot. In the presence of a blood clot and fat, it will completely what?
Close.
Zero blood flow. Zero means what?
Nothing.
Zero oxygen. No oxygen. The myocardium will die. It's called MI. And what is MI? Is that reversible or irreversible?
Irreversible.
Is this necrosis or is it necrosis? Is this reversible or irreversible? The cells are dead. How can you resurrect a dead cell? Definitely not, right? What kind of necrosis would this be? You have 4 types: coagulative, fat, liquefactive, or gaseous. What does coagulate mean? To form a clot. Coagulation pathways, the clotting pathways. So coagulate means to clot. The clot, together with the fat deposit, completely block the flow of blood. Therefore, there is no more blood flow, there is no oxygen. The myocardial cells will die. No longer reversible. What's an example of liquefactive necrosis? When there is what? An abscess formation, let's say in the brain or other organs, where there is the use of hydrolytic enzymes. On the other hand, what is fat necrosis? Fat necrosis is seen in what? Hemorrhagic pancreatitis. Remember pancreatitis? The pancreas is behind the stomach. The pancreas is an organ that secretes enzymes like pancreatic lipase. L-I-P-A-S-E. ACE means enzyme. Lipe means what? Fat. What does the enzyme do? Break down the fat. So what happens now if you have hemorrhagic pancreatitis? This is usually seen in young people who drink a lot of what?
Alcohol.
So if you keep on drinking alcohol, good for you, because you die. I'm just joking. Okay, social drinking, you're single, you want to meet women and men. Okay, hi, I'm single, I'm ready to mingle. You can drink. But too much drinking is bad. Why? Just like a drinking bit, let's say one day, it can cause to hemorrhagic pancreatitis. Most people die in their sleep. Because what happens to the pancreas? It can bleed, and what happens to all the enzyme there? And what will that lipase do to the fat here? Digest. So you wake up, you'll be in heaven. If you're good. I'm just joking, of course. So drink in moderation. This is really true. So be very careful. I'm not saying every time you drink you will die. No. You'll feel happy. Oh, God. But too much drinking is not good. And not only for the liver, because liver cirrhosis, but the idea is that it can also affect the brain. You end up with dementia. The bottom line is that hemorrhagic pancreatitis can lead to fat necrosis. Fat necrosis because of the release of lipase in the abdominal cavity. What's the 4th one? Tuberculosis leads to what? Caseous necrosis, spelled as C-A-S-E-O. Somebody spelled yesterday with an U, but it's C-A-S-E-O-U-S. Caseous what? Necrosis. Necrosis means death. And this is simplified by tuberculosis infection of the lung. Do you understand? Okay? Now, so reversible versus irreversible. The other example of reversible was intracellular accumulation, when there's something wrong with what? Certain enzymatic reactions within the cell and the body. Irreversible, as I said, would definitely be all the things that will cause the cell to die. Okay? Now, what about chapter 7? What is the topic about chapter 7? It's about neoplasm, right? Neo means new, plasm means growth. A new growth or tumor could either be benign or malignant. Which one is able to spread to other organs? Malignant cancer cells, right? They can spread in many ways. Number 1 would be what? To the blood circulation. Number 2 would be what? Lymphatic or lymph vessel, lymph node spread. The third one would be what? By contiguity. What do you mean by contiguity? Contiguity is a word which means what? Neighbors. Love thy neighbor. Okay? T-I-G-U-I-T-Y. Contiguity means, let's say you have an ovarian cancer. The cancer is in the ovarian area where you have the pelvic cavity. Can that cancer spread to the other organs here in the pelvis, like the abdominal wall or pelvic wall? Yes. Really sad, right? Because it's there. It's really there, it can spread. And therefore we know about that it can spread. And it's the reason why they can be fatal, right? So apparently, when you're dealing with cancer, you're dealing with a life-threatening condition. Fortunately, many cancers, there is no cure yet, right? And when we're dealing with cancer, we have to think of how to kill the cancer cell, right? If you want to prevent the spread or kill those cancers that spread, what treatment do we provide? Chemotherapy. Why? If you give the chemotherapy agents to the intravenously, it will what? Spread throughout. It will get to attack all the cells that are spread to other organs, right? To the blood circulation. The only problem is that it can go after cancer cells, but it can also destroy what? Normal cells. That's the reason why you lose your hair, right? In cancer patients. Fortunately for us, we're now able to discover better what? Combinations of chemotherapeutic agents. And fortunately, some of these drugs are actually discovered in some forests in South America or certain places where they can now use this as a form of cancer treatment. And we're still in the process of finding more drugs that we can get from maybe a plant or tree that is only unique to this particular place, you know. That's why we are trying to do our best to come up with better drugs, okay, for chemotherapy. Now, we know also that these cancer cells have a propensity to grow fast because they're greedy, they divide a lot, you know. The cell division or mitosis is, my God, phenomenal. What used to be a big mass like this became a big mass like this, and what is the term used when there is increased blood flow and formation of blood vessels in cancer tumor growth? Huh? Angiogenesis. Angio means artery, genesis means new arteries being created to sustain the growth of that particular tumor, right? And that's the reason why whenever we perform cancer surgery, they always have what? 8-10 bags of blood ready to transfuse, because the moment you get the tumor, you could lose a lot of blood, and you can die of the blood loss other than the tumor. Can you imagine? The surgery was very successful. We were able to remove the tumor, but your father died. Why? Because he had blood loss. You couldn't stop the bleeding. And that's the problem with cancer surgery. Especially when the cancer has spread to big major blood vessels like the aorta. Oh my God. It's better probably not to touch it, you know. Because they could actually they could die in the operating room. Right? And just have hospice and palliative care treatment of pain. That's all we can do. Okay? So, benign lesions, they don't spread. They usually insert in a capsule. Okay? And very often you can tell by the term you use. For example, if I say lipoma, what is that? Benign. Oma. Adenoma. Benign. On the other hand, if I say carcinoma, cancer. Osteosarcoma, cancer. Adenosarcoma, cancer. Gamosarcoma, cancer named after me. See? So anything has the word sarcoma, carcinoma. The only oma that should have been benign but actually malignant is lymphoma. Hodgkin's and non-Hodgkin's lymphoma. So lymphoma is not benign, it's actually what? A malignant type. Okay? You understand? So be aware of these things. But often than not, lipoma, fat, mass. Adenoma, mostly the digestive organs, smooth muscles, right? But other than that, adenosarcoma, squamous cell carcinoma, malignant. Okay? Okay, let's have a short 5-minute break. We come back, we have the quiz. And after that, we will have the division for the group. Okay? Let me turn off this.